Right from the day one of the planning, we have decided that we should come up with such a facility that it should not look like a hospital, it should not feel like a hospital, and it should not smell like a hospital. And because people are having a lot of fear about the cancer, with the word cancer. So our motto is freedom from fear of cancer, and we try to implement it here in NCI.
The National Cancer Registry program in India estimate that there'll be 1.39 million new cancer cases in 2020. And furthermore, 10% of all Indians will develop cancer over their lifetime. That's over 100 million people. The majority of cancer care, from diagnosis to treatment, is only available in the cities. And 65% of the population live in rural communities. So you can see the obvious problem. Here in Nagpur, central India, there's a hospital in a small town that is trying to address this lack of access to cancer care. And the founder, who I'm on my way to talk to, is Shailesh Joglekar. Shailesh, good afternoon, sir. How are you?
Hi, good
Let's do a
afternoon.
little bit of a COVID handshake.
Yes.
So, why this capability? Why Nagpur, which is central India?
For this, to answer your question, we need to travel 25 years back when one of very close friend of mine, he lost his father due to the cancer. Then after some years, I had a bad happening in my family. I lost my wife due to cancer.
I'm sorry.
And from that time, we both have started thinking that we have done everything for our family members. But we had been to different kind of hospitals throughout that journey. And we could realize that how costly cancer care is in India.
When you talk about the big costs involved with cancer care for the Indian people, what are those costs made up of?
Basically, see the equipments, medical equipments for the cancer diagnostics and the treatment part, they are very costly. So unless somebody donate these kind of things, then it's not possible for a very subsidized oncology diagnostics and treatment. So when we started this project, we requested a lot of philanthropic trusts and the public sector organizations to please come forward and help us to bring this project. Thinking line that we must come up with such kind of a charitable hospital which will serve to the poorest of the poor people in this area, central India. In March 2015, 20th February, we started the construction here. And within 2.5 years span, in August 2017, we inaugurated the phase 1 of the facility and dedicated the facility to the cancer patients.
Dr. Anand is the medical oncologist, or one of them here at the hospital. And he's a massively busy man. As I was setting up, the room was absolutely jam-packed. And this isn't as busy as it was earlier, and I know people have left the room to allow us to talk.
Yeah.
How many patients are you seeing a day?
See, we're almost seeing something like 100 to 150 patients a day.
100 to 150 patients a day?
Yeah.
What is the process here? You're in Nagpur, you're in central India.
They come here from the surrounding part of the city or surrounding part of the towns, small villages. An average patient travels around 200 to 300 kilometers to reach this place.
Hang on, say that again. The average patient travels 200 to 300 kilometers to get
Some
here.
of them, yeah.
Could we go and have a quick walk around? I know you're massively busy.
Yes, no problem. Yeah.
Let's go.
So in all, currently there are about 20-25 rooms for the outpatient clinic, right? Come along.
Dr. Anand,
Yeah.
are all of these people here, are they all here to see you?
Yeah.
Wow.
Yeah.
How do hospitals work in India in terms of public versus private?
Okay, so every hospital will have different patients from different socioeconomic strata. Some would have an insurance, some would be paying out of their pockets, and some would be from a poor background. In terms of the accommodation, there are systems created, like some patients would go in a general ward, some patients will go in the same private ward, some patients will go in a private ward. But that's only as far as the type of accommodation is concerned. Otherwise, the treatment remains the same. So that's how, even if a patient cannot afford to pay the hospital, we have our own charity fund. So the hospital funds the entire investigations and treatment without looking at the patient's pocket. So that's what we call an access to equal level of care for all patients, no matter what background the patient belongs to.
Got it.
So, right.
And you also treat children here as well.
Yeah.
How big is the pediatric ward, and how does the facility work for children?
You know, children are not small adults. They have different types of cancers. They have their own body physiology is different. So we need a separate approach to children suffering from cancer. At our institute, we decided that we'll treat these patients free of cost. Most of the cancers in childhood age are curable. So we have this children ward. This is a daycare center where the patients receive chemotherapy.
How many children are you seeing on a daily basis?
On a daily basis, we give chemo to around 15-20 patients a day. So their mother is allowed to stay with them.
And when children come in and they're diagnosed with those kind of cancers, how long are they staying for?
If it's leukemia, the treatment lasts for about 2.5 years. With some other kind of cancer, sometimes it might be 6 months, sometimes it might be 1 year. For every cancer, the treatment schedules are quite complex. So transportation, staying, food facilities, they are arranged free. We have a social department where people help the patients and their parents.
In the 20 minutes that I've been with you, I've had a glimpse of the amount of people that are in this hospital waiting for your wealth of expertise and knowledge. How do you personally cope with that?
I know, I've been in this field for 30 years, so it's tough to practice oncology, but then over the years I have because we do have our moments of rewards when we see patients getting cured and they're thanking us. That's the reward we get. We often do not succeed, but then we at least have the satisfaction that we have provided the best level of care that we could.
You're a remarkable individual and an angel dressed in a doctor's uniform. Thanks for telling me about your work today.
Thank you.